So good afternoon everyone, those of you who are present and those of you who are present here in the spirit. So my name is Dr. Ravi Gadani. I come from Department of Surgery. I am an assistant professor in Department of Surgery. And this 2 to 5 session, it may not even last so long. It is mainly about orienting you to clinical postings. What clinical postings are, what is expected of you and what you can expect. Initial overview or bird's eye view I will give, and then maybe I'll talk a bit about what is to expect in Department of Surgery. And later on, people from ENT, medicine, gynec, pedia, they all will come and they'll brief you about maybe their own department in short. So why clinical posting, if we begin from there? So let me ask you a question. Can you learn to ride a horse by reading a book? Can you learn to ride a horse by reading a book? No. So can you learn playing cricket? Can you learn even cooking? So cooking, yes, to some extent you can have some fair idea around some basic principles of recipe, what goes with what and everything. But unless you cook, you are not going to, sort of really test what you know, right? So theory and practical, these are very cliched terms. But what we talk about when you come to clinical postings, it is not really practical, it is actually practice. What you are seeing is practice. The turnout is really low, by the way, but anyway, all of you, if I ask you one question, that what is your job as a doctor? Can anyone shout out, like, what is your job as a doctor? Not today, okay? Like, once you are like, whatever you want to become, like, when you are 30, 35, 40, what's your job as a doctor? If you have to, like, maybe tell me in a sentence or in a word. Anybody? I'm sorry? Treat the patient. Is that what you said? Treat the patient, correct. So your essential job is treatment. So before treatment, what comes? What comes before treatment? So, yes please? Diagnosis. So before treatment, you need to know that this is what diagnosis is. So how do you arrive at a diagnosis? By examination. So do you think clinical examination itself is sufficient? Well, in some cases it may be, but in vast majority of cases it may not be. So what more will be required after clinical examination? Labs. So meaning investigations. So you want to treat, for which you need diagnosis, for which you may have ordered some investigations, and before that comes the examination. Before examination comes what? Sorry? History taking, right? So when you take history, it tells you which system to examine. Even when you examine that system, it tells you which investigation to order, so that you don't order 2,347 investigations in each case. Right? You have to be pragmatic. But once the diagnosis is there, the treatment is not as difficult for majority of illnesses. Like if someone knows that malaria hai, that patient can as well go to a pharmacy and ask the pharmacist, can you give me a treatment for malaria? Usually he would give, and maybe I can say that 20-30% he will be right also. The patient will get treated also. Okay? So your chief job is diagnosis. And it begins with history. So how do you take history? Is by talking to patients. That's how you take history, right? When the patient tells you their first symptom, you're sitting in the outpatient department and this is the door and the patient walks in. You have no idea what he has till he says the first symptom. He says, chhati ma dukh hai. So now you are reasonably like orthopedic is taken care of, not a gynecology patient, chest, So maybe something related to heart or lung. So then your mind starts to think in those. So you sort of exclude at every step, right? So now, would you agree to this thing that history taking is really critically important in medicine? Medicine means not medicine subject, like in medical field for us, right? Otherwise, if you as such want to order investigations and diagnose, anybody can do, right? But you are there for your discretion. So if history taking is so important, how can you begin to learn to take history? Anybody? તમે કઈ રીતે શીખશો સારી history લેતા? How will you learn or ensure that you take decent history? Not like, because it's a lifelong journey, so I can't say that you will learn it by the end of your MBBS, but so begin by talking to patient. I'm not even saying history taking. I'm saying talking to patient. So you go in the ward. If you are allotted a patient, fine. Other you can ask the resident, kaya patients is aase. You go and talk. Ask simple things. નામ શું છે? ક્યાંથી આયા છો? આ વખતે વરસાદમાં અસર થઈ હતી ઘરે? You can ask simple things, right? You don't need to like really start asking even before you ask the name, or you going from that every single box के नाम, okay, उम्र, क्या रहो છો, કેટલા કમાઓ છો, okay, fine, કયો ધર્મ છે, like I'm not asking you to get into that straight jacketed box of information, but at least talk. Now once you get familiar there, that is when the history will start to flow. Then you will ask simple things, શું તકલીફ થઈ, કેમ આયા? So then he will say, then you may fumble, एक minute, आमा next શું પૂછવાનું હોય? So then that is where the book may come in and the theory may come in. Okay, so the whole broad idea of clinical postings is to give you a taste of real medical practice. Okay, so this is the, like, history taking is the very, very fundamental base of any kind of arriving at diagnosis. If you look at, our wards, I think some of you are currently in pediatrics, some are in ComMed, and others are in orthopedics, right? 3 batches have gone to those 3, departments. So ward usually has 50 odd patients. There you can see residents and staff nurses being there, and so usually the doctor sees the patient, writes the treatment, and it is instituted by whom? Who gives the treatment actually? Staff nurse. So like the injections they are to be given usually by the staff nurse. Now there is something also known as case paper. So when you go in the ward, you see many patients. Each patient would have a case paper. Even when you would have gone as a patient or as the accompanying person of a patient in your real life to a doctor, તમારા કોઈ પેરેન્ટને કંઈ થયું હોય ને આપણે જોડે ગયા હોય, તો usually you are given a sheet of paper on which things are written. This is the diagnosis, this is the medicine. The same way when someone is admitted, there is an entire case paper. Now what you can do is you can of course pick up the case paper and learn a lot even from it. What kind of medicines are given, why is it given. So even if you learn just one point every day, you will really have accelerated your learning process in general, right? So your clinical postings, they are like 5 days a week, Monday through Friday, and it's from 9 to 12, and depending on various departments, they can range from 2 weeks to 3 weeks to 4 weeks, something like that, right? So this was just main thing, that our invitation as teachers to you is that if you really want to make most of it, then talk to patients. I'm not even at this point asking you to take history. Grab a piece of paper, grab a pencil, a pen, go to patients, talk to them. And then maybe slowly you can start, asking the technicalities like why you are here, what is here. You may of course then progress to clinical examination, like taking pulse and taking blood pressure and everything. But overarchingly, every teacher wants is you engage with the patient and talk to the patient. Right? તમને અત્યારે અંદાજો નહીં આવે કે how critical and vital it is and how fast would it make, how much it can accelerate your learning of a particular topic, right? So this is just the broad overview. As far as my department is concerned, Department of Surgery, the head of department is Dr. R.R. Patel sir, and you will have you have 3 years, like second year, third first, third second. So you would have 7, 4 and 10 weeks of posting. Each one of you will have 7, 4 and 10 weeks of posting each, during these 3 years. I mean, if someone goes in the, surgery, medicine and orthopedic, we are still here on this side, but gynec, pedia and everything is on the 1200 bedded hospital, which is the new block. Of course, you also want to understand that there are, when you are posted in a clinical term, there are cases which come as case presentation in your exam. Case presentation as your exam. But then the ward is not filled with only those cases. The ward has many other cases also. And you will also learn a lot even if you take history of a case which is not usually which doesn't usually come in your exam. If I give you an example, surgery, what kind of diagnosis you usually see in surgery, what kind of patients you see in surgery? So patients who have swellings, patients who have ulcer on the foot, certain thyroid swellings, hernias, inguinoscrotal swelling. These are the things that you see in surgery. But it does not mean that they are the only kind of patients that we have. Right? We have patients of intestinal obstruction and acute pancreatitis and many other. So even if you take history of those cases, you will keep on sharpening your skill of taking history, and it will help you indirectly in many ways. For surgery, I can say that we have 6 days a week, like your posting is 5 days a week, but when we have 6 days a week, our weeks are like 1 day is OPD and emergency, 2 days for planned operation theatre, and 3 days for ward round. So ward round are the days when clinical teachings can happen, and on OT days you can come inside the OT, of course wearing the OT dress and slipper and cap mask, etc. So of course observing those things. But we do actually encourage that you all come inside the OT and have a feel of what's the exact total management of a patient is. What are instruments? What are the various kind of instruments? How are they handled? Right? What is the behavior inside the OT, etc. So mainly all surgical branches would have this kind of disposition, like days when they have OPD, days when they have operation, and days when they have ward rounds. So you guys, as I told you, that you all are actually encouraged to be inside the OT, but naturally in the block of 4 or 5 students only each time. The rest can take history or they can be taught separately by the resident doctors. You are expected, especially in surgery ward, to carry at least stethoscope and measuring tape every day. When you are in medicine, you are also expected to carry a clinical hammer. You would have something known as logbook. Okay, so logbook, there is subject-wise logbook that each one of you will have. So the Department of Surgery, our logbook has 4 sections, out of which the first section is to be filled when you are about to finish your first clinical term. The second when the second clinical term, third and fourth accordingly. So that is how you will complete your entire logbook. And logbook and the assessment of that logbook carries some weightage in your internal assessment for the final year mark calculation. So logbook is important, right? We shall be sharing the logbook in PDF format on your group, which you can get a print of, and then you can, once your surgery term comes, then you can finish it. Examinations. So each clinical posting will end with one examination, or one exam. That exam will consist of in surgery, it will consist of one case presentation, one table viva, and one OSCE. So OSCE will have maybe 4 or 5 OSCE stations, right? It will be 100 marks and it will directly reflect in your internal assessment. So the better you perform in your exam, the better it is for you, because these things then stagger. They stack along over a long period of time when all the clinical terms are there. I think that is it all from my side. Thank you so much.